Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are no new cases of COVID-19 to report. The total number of cases remains at 325. There are no individuals hospitalized or in ICU currently. As of this morning, 314 individuals are listed as recovered, and there are 4 active cases. 379 lab tests were performed on Tuesday, taking our total to 68,015. So Manitoba's numbers remain favorable, but we need to remain vigilant to keep our numbers low. We certainly expect COVID-19 to continue to be around, and we expect to see COVID-19 again here in Manitoba, so we need to remain vigilant. Manitobans are well versed on the things that have led to our flattening of the curve: hand hygiene, physical distancing, and most importantly now as we move forward is to stay home when you're ill. This is going to be vital to our success. We can't have people with symptoms of respiratory illness going to work or to school. We need to ensure we're protecting everyone staying home when we're ill. Manitobans with symptoms of COVID-19, fever, cough, aches, runny nose, fatigue, loss of taste, smell, certainly should attend for testing. Early identification of cases is vital, so we can do that contact tracing, we can isolate cases, so certainly those who are showing symptoms should attend for testing. All of this advice is much more important to those at increased risk of severe outcomes due to COVID-19, those over age 65, those with underlying medical conditions such as cardiac or respiratory conditions, those with immune compromise. Very important to take extra caution when going out. Hand hygiene, ensure you're keeping that physical distancing from people outside of your household. Again, I'd like to remind people to be kind to each other. That this has been a challenging time for Manitobans. We're all in this together, but this is certainly not a time to fall back on judgment or shame. Be kind during these difficult times, and we're in this together, and Manitobans and Manitoba has really stepped up to put us in this position to continue our reopening plans, but let's be aware to continue to be kind to each other during these challenging times. That certainly applies to spreading of misinformation. Please access credible information. Our website, manitoba.ca/COVID-19, is a good source for that. And so that's all the updates I have, so I can open up to questions.
Dr. Roussin, what does it say when the Premier of the province, who's leading a pandemic response, is seen publicly, openly flouting rules designed to ensure that we flatten the curve?
Well, I mean, I think that the Premier has provided a comment on that, so I won't speak for the Premier. I think that it kind of goes to what I'm saying is that we're all in this together. Let's try to get through this. We all have our part, and I think that mask wearing certainly in Manitoba is going to become probably a bigger part of our response going forward. But as of right now, I think that we've done well here in Manitoba, and we should just continue to all try to do our part.
Have you spoken to him about this at all?
No, I have not had a conversation with him after that.
Do you have any advice for a politician such as the Premier, who's been away in Ontario for a week? He seems to be at home now, taking a few days away from the office. Is it a wise thing to maybe, if you've been away in Ontario, Eastern Ontario, for a week, to be at home for a bit and just monitor symptoms? Is that advice you would give him?
Yeah, so for anyone that's, say, exempt from our travel orders, the advice is much the same, is that when you are in other jurisdictions that might have a higher incidence than Manitoba, to take extra caution, the physical distancing, the hand hygiene, avoid being out when not necessary. And then upon return, very close monitoring for symptoms. Try to avoid high-risk situations, large groups, visiting necessarily unnecessary visits to healthcare facilities such as PCHs, and just really closely monitor symptoms.
Were you personally disappointed to see the picture of the Premier in the paper or on, or on television, speaking to the leader of the Conservative opposition in Ottawa without masks?
Yeah, I'm not going to comment in that way. I think my comment is the same, is that we're, shaming anyone, making judgment on people is not going to help us get through this pandemic. I think the messaging is clear, and I think everyone's learning over time, and we can all continue to learn lessons from these type of things.
He's not a long haul trucker, though. He's the Premier of the province, I guess. So, when you say shaming, I can see your concern that truckers who are doing their job and going out of a province and doing an essential service, and maybe if they're criticized or attacked unfairly, but Premier is the head of government, who has exhorted Manitobans to follow the rules, right?
Yeah, and I think in Manitoba we've done well under the approach we've taken here, but yeah, I would say that we've had examples of Manitobans that say didn't follow our rules or advice, and our guidance is to not necessarily be judgment or shaming, but to learn for all of us.
There's been some blowback against the airlines who have now started selling the middle seats on flights. And the airlines have said, well, we require masks, there's HEPA filters, there's screening of passengers. And I'm wondering whether you have a position on that. Should airlines be selling, if they go 3 by 3 on most of the planes, should they be selling all 3 seats?
Yeah, so there's especially early on in the pandemic, there were a lot of cases that were linked to or that were on flights. We actually found very little evidence of transmission on flights, even early on with it. So certainly I think that the mask use, appropriate precautions and screening is important. In saying that, I won't speak necessarily specifically on the airline industry, but I think that the use of masks, again, Manitobans, they're going to get used to hearing more and more about masks. It's probably going to become more and more of a approach we have here as we get closer, say, to respiratory virus season. But the big take-home message is that, for the most part, masks shouldn't be seen as a substitute for other precautions that we have, that hand hygiene, physical distancing, staying home when ill, and that's a message I'm going to continue to repeat.
Because you don't get physical distancing when you're in economy next to...
Right, yeah, so it's not relying as much on physical distancing there, but we do have a lot of epidemiology showing that the risks thus far on commercial flights has been, we haven't seen much secondary transmission on those flights.
You've mentioned a couple of times now that wearing masks is going to be something that we might see more of in the future. As we open up more things, do you foresee making mask wearing part of your public health order?
So, so I think we've never excluded any approach that we thought was going to be in the fitting with our best interests. So it's certainly not excluded from that. I certainly don't have any immediate plans on mandating mask use. But I think that as we move forward, that's our messaging, is that we need to learn to live with the virus, to be able to see this virus again without resorting to those public health measures or the strict public health measures that we have to close things down. And so mask use might be one avenue to that. And if necessary, certainly we would use a public health order, but I don't foresee that at this point.
So why do you foresee mask use being more of a factor in the future?
Well, right now we have such low transmission of the virus right now, so certainly it's not fitting to implement any further restrictions on Manitobans at this point. But as we see more and more circulation of, say, this virus, and no doubt we'll be in respiratory virus season, so we'll definitely see circulation of many respiratory viruses. That's a given. When we start seeing that, then our messaging might be stronger on mask use at that time.
When you talk about the season coming up for respiratory viruses, does that still fall under the public health emergency mandate to be able to cover off those as well, in addition to COVID-19?
Yeah, so our planning strategy right now is a respiratory virus steering committee, and so it just we're planning for the typical viruses that we see: influenza, RSV, or to name a couple. So in that is going to be a robust plan for increasing our uptake of the flu vaccine, especially those at high risk of severe outcomes. Because we're definitely going to see a respiratory virus season. We're going to have to treat it as a COVID virus season because we're not going to know whether COVID has made a return or not until it's really over. So we need to plan appropriately.
Are you expecting people to actually go and get the flu shot this year, when I think on an annual basis Manitoba struggles to get 25-26% compliance with going out and getting flu shots?
We have been seeing increasing uptake year over year, so we continue to expect that. But say comparing to the H1N1 of 2009, we had a substantial increase in uptake during that time, and so we're preparing for a significant increase in our flu uptake and really striving for that this year.
When we look at these low numbers, because I think this is 9 or 10 days without a new case, at what point do we look at lifting capacity numbers in places like churches or live music venues, those types of things? Because if there are so few actual active viruses out there, I think we're at 4 now. Is it really, how big of a risk are people at when it comes to something like that if it's so rare here in Manitoba?
Yeah, and so this is one of the hallmarks of public health interventions is the least restrictive means, and so we continually look at our restrictions and whether they're necessary at all or necessary at the level that they're at. So we are looking at that, loosening further restrictions. We see that the epidemiology in Canada is improving in the east as well. So we're also looking at how or when we could further loosen travel restrictions.
Thank you to the reporters in the room. We're going to jump to the phone lines now and start with CTV and Michelle. A reminder, one question, one follow-up. Thank you. Michelle.
Hi, Dr. Roussin. Michelle going from CTV. I'm just wondering about the testing numbers. We did 319 Tuesday. This is lower than what we were doing before. Are there any further strategies that you might be looking at to increase testing numbers?
So I think with the testing, the issue with testing is what I see as most important is the capacity. So we have a lot of capacity to test, and that's by far the most important thing. We've opened up the testing eligibility to really any Manitoban. Certainly any symptomatic Manitoban is who we recommend go for testing, and then we even have aspects of asymptomatic testing as well. So the fact that we have the capacity and the fact that we have really no restrictions on who can get tested, those are important things for me rather than a day-by-day number.
Do you have any inclination as to how much longer our 4 active cases will be active for? Or how soon could we possibly get to 0, I guess what I'm getting at there.
Yeah, so it would be, they would become recovered at 14 days past the date of diagnosis, and if they're asymptomatic at that time. So I don't have the exact dates on when they first became symptomatic.
From City TV, Jonas.
Good afternoon, Dr. Roussin. Just kind of parsing some of your comments. It sounds like you're kind of just laying the groundwork for us to understand that while the numbers are low, come fall, we are going to have to change the way that we deal with the virus regardless of the numbers, because we won't be able to tell whether the symptomatic folks have the flu or COVID. So this is something sounds like we should wrap our minds around already.
So I think that this coming fall and winter is going to be again a challenging time. We have our messaging that we're working on now about staying home when you're ill, and we know how many people are ill in fall and winter, even with mild symptoms. And now our messaging is, even if you have mild respiratory symptoms, you shouldn't be at school or work. So we're going to be getting Manitobans prepared to see increased absenteeism at work, increased absenteeism at school, because we want those people to be home when they're ill. And that's right, is that even if we see flu A activity in November and not COVID, we don't know that COVID won't be here in December or January. So we're going to need to treat this upcoming respiratory season as a COVID season until proven otherwise.
No follow-up. Thank you, Chief.
From Global, Brittany.
Good afternoon, Dr. Roussin. It's Brittany from Global News. I'm just wondering if you have any update on the federal antibody program that Manitoba had signed on to be a part of.
This is like the seroprevalence study?
Yes.
Is it? Yeah. So no specific updates. I know that Manitoba, we're also planning on doing a seroprevalence study here. I don't have any further details about where they are at with the national one. Again, these are population level studies. These are going to try to give an estimate on just how many Canadians, how many Manitobans actually were affected by COVID-19 to give us that actual prevalence rate. This isn't going to be about who is immune to COVID-19. People won't be contacted letting them know that they are immune or that they were infected before. This is completely a population level study, but we don't have any results or certainly any more details on that at this point.
New cases. How do you prevent Manitobans from starting to get complacent with this virus?
Well, I think it's a challenge. I think that it's our messaging. We've done well in Manitoba, and now we've had a stretch without any cases. But I think that the messaging is clear: is that we see this virus in other parts of the world. We see it in Canada still. So we are going to see this virus again. And so Manitobans need to expect to see cases. We need to prepare to see, an increase in cases in the fall, higher than even in our first wave possibly. So we need to prepare for that. We don't know that that's coming. But what we want is that we don't stop our progress because we see some cases. We need to expect to see cases here. So we're going to do whatever we can to not get back into a area where we were in March and April with large shutdowns. We want to learn how to live with this virus. We need to anticipate seeing this virus and ways of, it's impossible to eliminate our risk. We have to live with some risk, but we should find ways to reduce that risk, especially in those that are most susceptible to severe outcomes.
From the Brandon Sun, Devon.
I have no new questions at this time. Thank you, Bill.
Thank you. We will now turn it back to reporters in the theater in room 68.
Dr. Roussin, I have a non-COVID question. With the recent heat wave that we've had in the past few weeks, I'm wondering are you aware of any deaths in Manitoba that are tied to heat distress at all?
So none have been reported to me. This is something that we've been looking at to find a way to have that better reported to us. That requires a case definition and often work with medical examiners and things of this. But so it's not a reportable condition. So sometimes we do hear of reports of it, but I have not heard any reports this summer yet.
Would you like to see this being a reportable type thing?
No, I think it's a significant public health issue, and it's becoming more important. So over time. So it is something that we're working on to be able to have better information on it. Certainly, we're not blind to it. There are some indicators that we use, but we don't get say case reports as we would for say COVID or any of the sexually transmitted infections.
So far, you're not aware of any cases directly related to the heat, but there could be.
That's right.
Ms. Siragusa is not here, so I'm going to ask you, and you probably don't have this information at your fingertips, but how is Manitoba managing its PPE supply if our numbers continue to stay low? The numbers are higher out east, but we're seeing some improvement in Ontario and Quebec. Are we shifting PPE to other provinces? Are we keeping a stockpile here in case we see a flare?
That's right. So I'm not aware of us shipping PPE out. I'm not acutely involved in that kind of the logistics to it. But certainly we've managed to increase our stockpile of PPE. We have a much better system on tracking our stores of PPE, and so we're going to continue to ensure we track that because. We know that for sure fall season is going to bring with it more respiratory illness.
Do you know how much has been spent on PPE? If there's an update to the financial update that came out a couple of weeks ago, where it said just shy of $400 million has been spent on PPE. Has there been more in that or more since then?
No, I don't have any info on that.
Dr. Brock Wright has announced his retirement. Do you have a comment about his tenure here at Shared Health and his looming retirement?
Yeah, so it's I wasn't aware of that until the other day, and it's I think it's for our health system it's it's a loss. He's a great leader. He was a mentor to me through my training in public health. And so, I think that most people that have worked with him and worked in the system are sorry to see him go and wish him all the best.
Lots of experience.
Absolutely.
Thanks very much.
All right, thank you.
Thanks very much.